So I thought I might fly under the radar with the ALS Ice Bucket Challenge, but my coworker Spencer Lewis nominated me yesterday, and so here I am. I in turn will challenge Josh Levig, Matt Brecky, and Victor Perea. Victor, I saw that you were nominated a few days ago, but I haven't seen a video yet, so you're up now. You have 24 hours to complete the challenge. I'll also tag all of your wives so that they can make sure that you guys don't chicken out. I've heard a lot of cynicism regarding the challenge, so I'm going to cover all my bases. First of all, as you can see, I have a bunch of water here, actual ice in it. It's a lot of water. I'm not too excited about it. It's rainy, it's overcast. It's been hot for like 2 weeks, why couldn't I get challenged a week ago? Anyway, I've also heard people saying that dumping ice water on your head doesn't really do any good, but I've also donated $100 to the ALS Association, and you can donate to whether or not you've been challenged at alsa.org. Another complaint I keep coming across, and this is one of the most legitimate ones for me, is that all these people are raising awareness, but no one really knows about the disease. So I'll tell you a little. I knew some beforehand, and I spent part of my day researching the disease. So ALS is amyotrophic lateral sclerosis. If you know your Greek, it basically means that the disease is characterized by a wasting away of your muscles and a hardening of portions of your spinal cord, specifically the motor neurons. It's a pretty rare disease, fortunately. There are a couple 100,000 patients worldwide, 30,000 or so in the United States, where it's better diagnosed than the rest of the world. Because it's so rare, funding for ALS research is significantly behind that of other diseases, cancer, HIV, heart disease. Pharmaceutical companies don't have as big a demographic to target. They're not going to make as much money. The research money just lags behind. So compared to these other diseases, ALS is very poorly understood. There are indications for hereditary risk factors. It's unclear whether there are lifestyle choices that increase or decrease your risk. It's affected the greatest athletes, from Lou Gehrig to the greatest minds in Stephen Hawking. Another difference between ALS and other diseases is that you have ALS. If you're one of those 30,000 people in the United States that has ALS, you are going to die from the disease. There is no transplant that can be done. There's no remission that you can go into. As of right now, there's very little done that can be done to slow the progression of the disease or remediate the symptoms at all. Every one of those 30,000 is going to die, but not before they lose their fine motor skills, their speech becomes slurred, they begin to stumble, they'll eventually become bedridden, losing the ability to communicate, swallowing will become difficult, and ultimately they'll be unable to breathe on their own. All the while, they'll be able to feel everything, they can see, they can hear, they can taste, their brains work perfectly fine. They're just going to be trapped by their own deteriorating bodies. Most will die within a couple of years of the first symptoms. If they're lucky, like Dr. Hawking, it's going to progress slowly enough to where they'll be wheelchair bound for a few decades with constant nurse care. So research is underway with the goal of slowing neurodegeneration as a result of ALS, but resources are limited, which is why donations are needed so badly. And lastly, the most pedantic of complaints that I've heard is that we're in a drought, all this silly activism is a waste of water, but come on, just take a couple minute shorter shower, it's only a few gallons. But either way, just to satiate all those naysayers, I'm going to do it in my vegetable bed here between the corn and tomatoes, so at least they'll reap the benefits. Here we go. That sucked.